Hello, my name is Nina Reeves from Stuttering Therapy Resources. We are bringing you another video tip in honor of National Stuttering Awareness Week. You may have already enjoyed the video that my co-author Scott Yaris did on helping children deal with bullying and teasing due to stuttering. Today's tip is going to be about the 5 ways to help generalization of skills from the therapy setting into the real world. We wanted to highlight this topic because we know that many speech-language pathologists and parents of children who stutter are often frustrated when children learn and practice communication skills that we teach in therapy, but then have a lot of trouble using them outside of the therapy setting in the real world. There are a lot of things that we as speech-language pathologists can do to help generalization of skills. But we want to take a brief moment to highlight 5 that could have the most impact. First of all, let's begin with the end in mind. What I mean by this is that generalization begins from the very first day of intervention. As we know, communication in the therapy setting can be somewhat artificial and does not always resemble real-world context. For therapy to be efficient and effective, we cannot wait until a child has mastered a skill in therapy to begin to move that skill to new and more natural situations. Therefore, we create a generalization atmosphere by what we say and what we do, and by how we assign and structure home practice sessions. This atmosphere helps children understand that the skills and concepts we learn in therapy are meant to be practiced and then used in the real world. Secondly, we move through skills acquisition and maintenance along a hierarchy of difficulty. As SLPs, we know that hierarchies are a part of therapy every day for all of the communication disorders with which we work. We use hierarchies in stuttering therapy to help children learn to enhance their skills in easier situations and then move to more and more challenging situations. As an example, when utilizing hierarchies to enhance generalization, we may ask children to list their frequent communication settings and situations. For example, speaking in the classroom, speaking with strangers, speaking with kids on the playground or in the neighborhood. And once they create a list, we help them arrange the situations from easiest to most challenging from their perspective. Then we use this hierarchy to support children in expanding the reach of the concepts learned in therapy to more naturalistic settings. The third tip I want to discuss today is to make practice real. Once a child has learned a new skill, we begin to practice with materials and subjects that matter to the child. For example, I tend to shy away from frequent use of word lists and help the child and family use more personal ways to practice, such as spelling words, game night, social studies terminology, or discussing hobbies and interests of the child. We can also make practice real by helping children use their speech handling techniques in more natural ways. It sometimes escapes adults who don't stutter that speech techniques we teach in therapy sometimes feel and sound weird to a child who stutters. This, of course, can hinder generalization. So our role is to help the child desensitize to using techniques in a variety of settings, while in turn helping them increase the naturalness of the technique. We also need to change things up in therapy. No matter what our work setting, we can make small adjustments to therapy activities to help foster generalization. We can change up the length and complexity of stimulus materials, include peers or siblings in therapy sessions, practice skills that we are working on in varied settings in our own work environment. For instance, go and practice in the cafeteria or in another office or in the lobby. These small changes along a hierarchy of difficulty can be key to bringing therapy concepts into the real world for children who stutter. And finally, we must strive to include everyone in the process of therapy. Parents, teachers, siblings, and others can better support a child who stutters when they understand the disorder of stuttering and the process of therapy. These significant others in the child's life can be active practice partners who understand the challenges of trying to manage stuttering in the real world and in the long term. A knowledgeable support system is a child's best ally, and we can help create that support system by including others and educating them on why we are doing what we are doing in every step along the way of therapy. Of course, what I have outlined in this video message is not an exhaustive list by any means, but I hope it has presented some helpful information for increasing generalization in stuttering intervention. We outline these and many more ideas for enhancing generalization in Chapter 11 of our book, School-Age Stuttering Therapy, A Practical Guide, which is available at Stuttering Therapy Resources. The website is www.stutteringtherapyresources.com. If you have any questions about this resource or any of the other therapy guides and workbooks that we have in our publication catalog, you can email me at Nina, that's N-I-N-A, at stutteringtherapyresources.com. Happy National Stuttering Awareness Week, and we look forward to seeing you soon when we present our next video tip.